The medical assistant performs a distance visual acuity test to screen for the presence of myopia or nearsightedness. The Snellen eye chart is used the most often in the medical office to assess visual acuity. School-age children and adults are tested using a chart that consists of letters in decreasing sizes. Preschool children, non-English speaking people, and non-readers are tested using a chart with the capital letter E in decreasing sizes and arranged in different directions. A visual acuity chart with pictures of familiar objects can be used with preschoolers. But this chart is less accurate than the Snellen chart because some children may have good vision but are not able to recognize the objects. You may have heard people say they have 20/20 vision, but what does that really mean? Notice at the side of each row of letters there are two numbers separated by a line. The number above the line represents the distance in feet at which the test is conducted. This is typically 20 feet. The number below the line represents the distance from which a person with normal visual acuity can read the row of letters. The line marked 20/20 indicates normal distance visual acuity, or 20/20 vision. The person could read this line at a distance of 20 feet. A visual acuity reading of 20/30 means that the smallest line the person could read at a distance of 20 feet is one that a person with normal vision can read at 30 feet. A visual acuity reading of 20/15 means that the smallest line the person could read at 20 feet is one that a person with normal vision can only read at 15 feet. Make sure the visual acuity test is performed in a well-lit room that is free of distractions. With a tape measure, measure off 20 feet from the chart. Mark this spot on the floor with paint or a piece of tape so you don't have to remeasure it each time. Sanitize your hands. Assemble your equipment. You will need a Snellen eye chart, an eye occluder, and an antiseptic wipe. Clean the eye occluder with an antiseptic wipe to disinfect it.
11.
Identify the patient and explain what you plan to do.
Before the doctor does your physical exam, I need to test your vision. Have you ever done this before? Yes.
The patient should be instructed to wear glasses or contact lenses for a distance visual acuity test unless they are for reading.
Okay. So they tested it.
Ask the patient to stand on the marked line located 20 feet from the eye chart. To obtain the most accurate results, position the center of the Snellen chart at the patient's eye level. Stand next to the chart so that you can indicate the line the patient should identify. Test the acuity of each eye separately. Establish a pattern of starting with the same eye each time to reduce errors when you record results. Most examiners begin with the right eye. Ask the patient to cover her left eye with the eye occluder. Since this patient wears glasses, she should be told to place the occluder in front of her glasses gently to avoid moving them from their normal position, as this can cause inaccurate test results. If the patient is not wearing glasses, the occluder is simply placed over the eye not being tested. Instruct the patient to keep the left eye open. If the patient were to close the left eye, this would cause squinting of the right eye. Squinting in the eye being tested can temporarily improve vision, leading to inaccurate test results. Tell the patient not to squint or lean forward during the test. Start by pointing to a line that is several lines above 20/20 to give the patient confidence and help him become familiar with the procedure. A suggestion is to start with the 20/70 line. Ask the patient to say aloud what she sees on the line. If the patient can read the 20/70 line, proceed down the chart until reaching the smallest line of letters the patient can read. If the patient is unable to read the 20/70 line, go up the chart until you reach the smallest line she can read. Jot down the numbers that were at the side of the smallest line of letters that the patient was able to read. With her right eye, Leah read the 20/40 line with one error. This is interpreted as 20/40 minus 1. If one or two letters were missed, record the visual acuity with a minus sign next to the bottom number, along with the number of letters missed. If more than 2 letters were missed, the previous line is recorded. Next, ask the patient to cover the right eye with the occluder while keeping the right eye open. Measure the visual acuity in the left eye following the same steps as you did for the right eye. While the patient is reading, check for squinting, head tilting, and eye watering. These indicate the patient may be having problems identifying the letters. With her left eye, Leah read the 2030 line with 3 errors. Since she missed more than 3 letters, the previous line is recorded, which is the 2040 line. Chart your results. Include the date and time, the name of the test, which is the Snellen test, the visual acuity results, and any unusual symptoms the patient exhibited during the test. And be sure to chart if the patient was wearing corrective lenses during the test. The abbreviation for without correction is SC, and the one for with correction is CC. Latin abbreviations are used to record visual acuity. The abbreviation for the right eye is OD, the left eye is OS, and both eyes is OU. Disinfect the eye occluder with an antiseptic wipe. Sanitize your hands.